Many people hear the word inflammation and immediately think of injury, infection, or autoimmune disease. They imagine swelling, redness, or pain in a specific location. But most chronic inflammation does not start that way. It develops quietly, gradually, often without clear warning signs. And very often, it starts in the gut. The gut is one of the largest interfaces between your body and the outside world. Every day, it is exposed to food, bacteria, toxins, and environmental signals. Its job is to decide what is allowed in and what must stay out. Because of this role, the gut is deeply connected to the immune system. When the gut environment becomes unstable, the immune system responds. Over time, this response can become chronic inflammation. Inflammation itself is not the enemy. It is a protective process. It helps the body respond to threats and heal damage. The problem arises when inflammation stays activated for too long or is triggered too easily. This is what we call chronic low-grade inflammation. It does not cause dramatic symptoms at first, but it slowly affects energy, mood, metabolism, hormones, and overall health. The gut plays a central role in regulating inflammation. About 70% of your immune system is located in and around the gut. Immune cells constantly sample what is happening inside the digestive tract. They are trained to tolerate normal food and beneficial bacteria while responding to real threats. This balance is delicate. When the gut barrier is functioning well, the immune system remains calm. Signals are clear. Responses are appropriate. But when the gut environment is disrupted, immune signaling becomes confused. The immune system begins to react to things it would normally ignore. One major contributor to this process is disruption of the gut barrier. When the barrier becomes more permeable, substances that should stay inside the gut can enter the bloodstream. These substances are not necessarily dangerous on their own, but they do not belong in circulation. The immune system detects them and responds with inflammation. This inflammatory response is not localized to the gut. Once immune messengers enter the bloodstream, they can affect the entire body. This is why gut-driven inflammation can show up as joint pain, skin problems, fatigue, brain fog, headaches, or hormonal disturbances. The source may be in the gut, but the symptoms appear elsewhere. Another key factor is the gut microbiome. The bacteria living in your gut are not passive passengers. They actively influence immune function. Some bacteria produce anti-inflammatory signals that help calm the immune system. Others can promote inflammation when they dominate. When microbial balance is disrupted, a state known as dysbiosis, inflammatory signaling increases. This can happen after antibiotics, infections, chronic stress, poor sleep, restrictive diets, or long-term illness. Dysbiosis does not mean all bacteria are bad. It means the ecosystem has lost balance. Inflammation also affects gut function in return. As inflammation increases, gut movement can slow or become irregular. Blood flow to the gut may decrease. Digestive enzyme production can be altered. This creates a feedback loop. Poor digestion worsens gut imbalance, which increases inflammation further. Stress plays a powerful role in this process. Chronic stress does not just affect the mind. It directly influences immune behavior. Stress hormones alter how immune cells respond. They can increase inflammatory signaling and reduce tolerance. In the gut, stress reduces protective mucus, alters microbial balance, and weakens barrier integrity. This means that even with a perfect diet, chronic stress can drive inflammation. This is why many people feel frustrated when they do everything right, but still feel unwell. The system is responding to signals beyond food. Sleep is another major regulator of inflammation. Poor sleep increases inflammatory markers throughout the body. It also disrupts gut rhythms and microbial balance. Even one night of poor sleep can increase inflammatory signaling. Chronic sleep disruption compounds the effect. Diet does matter, but not in the simplistic way it is often presented. Inflammatory responses to food are not just about the food itself. They depend on the state of the gut barrier, the microbiome, the immune system, and the nervous system. A food that is tolerated well in one context can cause symptoms in another. This is why food reactions can be inconsistent. Some days a food causes no problem, Other days, it triggers symptoms. The difference is often the underlying inflammatory state of the system, not the food alone. Another misconception is that inflammation is always obvious. Many people with chronic inflammation do not feel acutely ill. They feel tired, stiff, foggy, unmotivated. They may gain weight easily or struggle to recover from exercise. These subtle signs are often dismissed or attributed to aging or stress alone. Laboratory markers of inflammation may also be normal or only mildly elevated. This does not mean inflammation is not present. It means it is low-grade and systemic. The body is adapting, but at a cost. Inflammation affects metabolism as well. Inflammatory signals interfere with insulin sensitivity and energy production. The body becomes less efficient at using fuel. Fat storage is favored over fat release. Hunger and satiety signals become distorted. This makes weight management more difficult and increases fatigue. Hormones are also influenced by inflammation. Chronic inflammatory signaling can interfere with thyroid function, sex hormone balance, and stress hormone regulation. This is why gut-driven inflammation can present as hormonal symptoms, even when hormone levels appear normal on standard tests. Many people attempt to reduce inflammation by suppressing symptoms. They use anti-inflammatory supplements, medications, or extreme diets. These approaches may provide temporary relief, but they do not address why inflammation is present in the first place. Suppression without regulation often leads to recurrence. Reducing inflammation sustainably requires restoring balance in the gut. This includes supporting the gut barrier, improving microbial diversity, calming the nervous system, improving sleep, and reducing chronic stress signals. It is a systems approach, not a single intervention. This process takes time. Inflammation does not develop overnight, and it does not resolve overnight. The body needs consistent signals of safety and support. Quick fixes often fail because they do not change the underlying environment. It is also important to avoid becoming afraid of inflammation. Fear itself is inflammatory. When people constantly monitor symptoms and worry about every sensation, the nervous system remains activated. This activation feeds into immune reactivity. Understanding reduces fear, and reduced fear supports healing. Inflammation is not proof that your body is broken. It is proof that your body has been responding to something it perceives as a threat. The goal is not to shut the immune system down, but to give it fewer reasons to stay activated. In future videos, I will explain why inflammation becomes chronic, how it affects metabolism and hormones, and how to approach healing in a realistic and structured way. If you want calm, doctor-led explanations that connect gut health with whole-body inflammation, subscribe to this channel. Healing is not about fighting inflammation. It is about restoring balance and communication within the system. Thank you for watching.